Or to the cloud. Okay, we are recording. Hello, everyone. I am Dr. Karen, and I'm so glad you're here. I just love this topic. I've been doing nutrigenomics for 5 years now, 5 years, and it's just transformed the way that I've done business or worked with my coaching clients. And I am going to explain it in as simple version as possible to you tonight. And we're going to use some slides and then wait till the end because I have a very special, I'm just so delighted that I can offer you this amazing special and that'll go through till Friday if you're interested in pursuing this. So I'm going to share my screen right here. Take this up here. Okay. And Ankita, I have you on my text here in case anything happens to our screen. So you are here. It's like the airplane saying, you are here to listen to the secrets in your genes. If that's not what you think you were doing, then you're in the wrong place, but I'm glad you're here. So I am specifically in these, 45 minutes or so, going to talk to you about all about this word, nutrigenomics, how nutrigenomic testing can support physical and mental health. So I always like to tell you who I am because anytime you hear anybody speak, you want to know who they are and what their background is. And I see, okay, I had a question here, but it's gone now. Okay, so as you probably can tell, maybe kind of sort of, I have an accent, I don't know anymore. I went to medical school in Australia. I've been living here in Southern California for 30 years. And I love to see in the chat where you are all from. We cover many states today, and I believe someone from the UK is joining us. Then I went on to do a master's degree in psychology because they don't teach you anything about the mind-body connection in medical school. And I founded my own wellness business in 1997, which I can't even count how many years that is now. That's a lot of years, like 25 years, right? Long time. Because I really wanted to be part of a creating health movement. That's my big passion, is teaching about what creates health. And in medical school, they teach you more of what creates disease, which is very important as well, but I've moved more into this coaching realm. So can you believe I've been a coach for 22 years? I kind of started coaching when it was just brand new. And then I went to the IIN, Institute for Integrating Nutrition course, because they also don't teach you anything about nutrition in medical school. And then I began this nutrigenomics training, teaching, testing in 2017. So as I said earlier, it has transformed the way I do my coaching business. And I know we have a lot of coaches, we have a lot of wellness business folks on the webinar today. And I love teaching about how this can potentially transform your outcomes with your clients because it has mine. And I just love how this integrates beautifully. So thank you. Many of you asked questions in your registration, and some of the amazing questions we had that, by the way, I will answer all of them in the webinar tonight is someone was interested in what they can control and what they cannot control. Great question. And this particular kind of testing can teach us that because nutrigenomics, everything that is tested can have a lifestyle application. So I'm going to say right up front, because this is a very important message. This is not testing for genes like the breast cancer gene or the gene for blue eyes or green eyes, because there's nothing you can do about that. It is what it is. This nutrigenomics testing is for small variations in proteins on the genes that can be switched on or switched off. And these are the things we can control. And that's what I'm going to be talking about today. So types of health conditions, disease markers, yes, and I'll cover that today. Tests to find out personal nutrigenomics. I'm going to give you an example of what tests I use and what the reports look like. How do you integrate it into your coaching business? So one of the things I suggest is you do the test yourself with me so you understand how this works. And then if you're interested in integrating it, that's a really good foundation for you to go on and do some training that I can recommend. And should we encourage our clients to have nutrigenomic testing done? That's a good question. When you hear about this yourself and maybe do it yourself, you will know those clients that you feel you might want to recommend this to. So it's not absolute, one size doesn't fit all, but when people are really interested in lifestyle application and changing their healthcare outcomes, then nutrigenomic testing can really help with that. And what tests do you recommend? Yes, I'm going to tell you that. So these were great. These were just some of the questions you submitted, and thank you for submitting all of those. So this is what we're going to cover tonight. Genes are not your destiny, and I'm going to give you such a great example of how you can understand this concept of epigenetics or nutrigenomics, and then how this testing can support physical and mental health, give you specific examples, and I'm going to give you that special. It's an amazing special. I can only offer twice a year, and this is the last time this year that you can take steps towards your own nutrigenomic testing. So let's get started. Genes are not your destiny. We are not at the fate of our genes. So there's this word epi around epigenetics, which means how genes are affected by our environment. And remember, I said this is not about genes that you can't do anything about, like blue eyes, green eyes. This is genes, the small variations in genes or the proteins in genes that through lifestyle can be switched on or switched off is the best way to explain that. Can be activated or silenced. That's epigenetics, the effect of our environment on the expression of genes. So this is another way to look at it. You have a genotype, and then you have the environment, and that interacts with your personalized health with nutrigenomics. So if we look at your genotype through the nutrigenomic testing, we can make specific lifestyle recommendations, meaning environment, on how we want those genes expressed or not expressed. Good news is there's some beneficial variants. There's some variants that show that you have actually positive outcomes. Okay, so nutrigenomics, nutrition, genomics. The relationship between nutrients, diet, and lifestyle. This is not just about what we eat. Nutrition, and this is my version of the definition and the way that I do my reports, nutrition is everything that nourishes us. It's our whole lifestyle. It's everything that affects our health, and it can affect gene expression. So that's how I define nutrigenomics, and you'll see why when you see these reports. I love this picture because it's pretty obvious the effect of this kind of food here on our genes or this kind of food on our genes. I don't have to really give that much explanation. So nutrigenomic testing can reveal, now here's that question someone asked about, which conditions can I know a genetic risk for with this testing? So Alzheimer's is certainly a big one that most people are very interested in. And yes, there is a particular variant that can show an increased risk for Alzheimer's, diabetes, osteoporosis, vitamin metabolism, methylation issues. Now, I'm not going to get into the science tonight. That's not what this is about. I want to give you an overview. Certainly when you do the testing, you'll dig deeper into your own reports and what all this means. But methylation, just think about, is about DNA synthesis and repair, which affects everything in the body. So it's a good thing to know how you are methylating, which means the enzymes in this process of methylation to do with DNA synthesis and repair. And nutrigenomic tests tell you that. Food sensitivity, gluten, lactose, salt, caffeine, all of these things, how you genetically have any risk factors for food sensitivity. We find this quite a lot where people haven't known that themselves, and it helps with lifestyle change. And then in the mental health arena, addictive behavior, depression, anxiety, cognitive decline, and much more. So there's so much. Now, remember, this is genetic risk. It does not mean you get it or you don't get it. It shows the genetic risk. But the great news is then we can set a lifestyle action plan based on your profile. And that's why one of the reasons I love doing this is I can take the top 3 priority areas, maybe it's diabetes or methylation or detoxification, and then we can dig into the lifestyle factors that are needed to support that genetic risk, to make sure that it's not expressed. And we'll certainly dive into that tonight. Okay, so I love polls. So I want to launch this poll. And looks like I spelled this word wrong. I apologize for that. But I'm going to launch this. Nutrigenomics testing. Have you ever had nutrigenomics testing done? So if you have yes, I bet that's Rose that said that, or no, let's have a look at the responses to those that are participating live tonight, just so I know. Can't believe I did a little typo there when I created this poll. But I'm just really interested to see how many of you have had. So remember, nutrigenomics testing, if you've ever had the Alzheimer's gene tested or the methylation, MTHFR, any of those. So let's have a look. Thank you, everybody. I'm going to end the poll here so you can see the results. I'm going to share the results. So yes, we've had 23% said yes and 77% said no. So that means that you are all in for, oops, didn't want to do that. I wanted to come back here. You're all in for a treat tonight as we work with our nutrigenomics testing. Okay, so I want you to just move around a little bit because I'm actually going to give you this very specific example that I think highlights so powerfully the power of nutrigenomics. So see this little fat yellow mouse. So this poor little mouse has what we call the agouti gene. When they have this agouti gene, they have yellow coats, they're extremely obese, and they have a high rate of cardiovascular disease, diabetes, and cancer. So they did this study where they wanted to look at the effects of dietary supplementation, specifically, remember I used that word methylation, methyl-rich supplements, folic acid, B12, betaine, all the B vitamin category. They wanted to study the effects of these supplements on pregnant mice with this gene. So group A, they're both pregnant, right? Pregnant mice with the agouti gene. So group A had no supplementation with these methyl supplements. Group B had methyl supplementation, folic acid, in their pregnancy. And the next slide is just so amazing. These 2 little offspring are genetically identical, but remember group B were given methyl-rich supplements. So they both have the agouti gene, but the methyl-rich supplement suppressed the gene in group B, but group A did not get supplementation. So these are genetically identical, but with lifestyle, they're able to change the expression of that gene. That's called nutrigenomics. And in this case, it's methyl groups, and it's part of our nutrigenomic testing to look at your methylation status. And it changes the binding characteristics of proteins. So that's nutrigenomics. Maternal methyl supplementation reduces obesity, diabetes, and cancer. So in this case, methylating DNA can silence or modify that gene activity. So just think about that picture of those genetically identical mice, but one had the supplementation, the other didn't, these 2. Amazing. An enriched environment. And that's why I love this work, because we can really work on lifestyle to silence some of the predispositions that might show up in your nutrigenomic report. And by the way, that includes the Alzheimer's risk gene, because it's not an Alzheimer's gene per se. It doesn't say you're going to get it or not get it. It's just a predisposition, which with certain lifestyle, we can keep suppressed. So that's what we're going to talk about today. Genes, they load the gun, but your lifestyle pulls the trigger. And I wrote this book, Is Your Lifestyle Killing You? I don't know, 10 years ago, because I always knew the power of lifestyle, and it just doesn't get enough airplay. And if we have coaches out there, that's what we do. We help people with lifestyle. So we are epigenetic engineers. That's what we are. But it helps to know what you're actually engineering, which means you know your genetic predisposition. So we study the way expression of genes are switched on or off by all of these environmental factors. So let's dig into this. What can nutrigenomic testing, how can that support our physical and mental health? So with that, I need to talk about functional medicine. So many doctors, other wellness practitioners go on to do extra training in functional medicine, which, just so you know, in a simple way, it means that we look at the root cause of disease, not the disease per se itself. So Jeffrey Bland, who's the so-called father of functional medicine, he wrote a book called The Disease Delusion, which is about if we label something depression, heart disease, anxiety, we go down a path, a silo path of treatment. But the truth is, all of these have similar root causes in lifestyle. And this is what we want to look at. And one of the reasons I love using the report I do is it focuses on things like detox status, how well you're able to detoxify, inflammation, which we know is the root cause of all of these conditions, digestive issues, the gut health, sleep deprivation, stress, sedentary lifestyle. So functional medicine looks at the roots, not the leaves. And nutrigenomics testing allows us to look at the root cause of some of these illnesses, diseases. So how do the tests work? So what basically the bottom line is, your unique genetic code offers guidance to improve or mitigate genetic predispositions. That's why we do nutrigenomics. We look at your unique genetic code and what might be putting you at risk for certain conditions, and then what we can do about it. So a lot of times when people say, well, why do people do this kind of testing? Well, maybe you have a family history of chronic disease. And I know a lot of people with a family history of, say, Alzheimer's are very concerned about their risk for Alzheimer's. So that could be a reason, or diabetes, or osteoporosis, a desire to improve your overall health and well-being. And that certainly is the case, because we get really detailed about what to do in terms of action from these tests. Identify priority areas, because these days we want to really do personalized wellness, where we identify what's important for that person. Targeted action as part of a holistic wellness plan, and health coaches wanting to personalize your recommendations for a client. So there's just some reasons. So the big question I get, and I'm going to focus a lot on this webinar so you understand, is what tests to do. So I'm going to share with you the testing that I have been doing, that I love, and how I do it. So when you're choosing a test, and there are many tests out there, 2 factors I have found in my 5 years doing this are, one, you want to make sure that the test that is being done is testing for genetic variations that are known, as in a body of evidence, are known to have a significant effect on health and susceptibility to chronic disease. So you want to be testing for things that you know we can actually do something about, we can action. Plus, test report. This is, to me, this is the deal breaker. A lot of tests give you a report, and all it does is show this whole list of genes. Like, what does this mean? I have no idea what this means. But you want a report that actually you could look at and not have any genetic background and understand what it means, and actually gives you actionable lifestyle. And there are not many, I'm here to tell you, that I've discovered that have that capability, that translates the information into lifestyle action steps. Now, I go a step further, and I do a Zoom session with every one of my clients that do nutrigenomics, and we go through the report, and I create action plan. But the report itself needs to be understandable, not just a whole list of genes. I had someone come to me actually at my boot camp, and she knew that I did this, and she said, could I bring my test report in so you could look at it? And she did. And all it showed was all these genes names, which are all very weirdly numbered, by the way, nothing understandable about it. And I said, did they not give you a report that was useful? She said, no. I said, well, this is not a good thing. You need to go back and ask them. She paid good money for a report that gives you an analysis of what this means. I was very disappointed in that report. So two of the tests I do is DNA health and DNA mind. The DNA health will show you individual genetic variations associated with things we talked about: osteoporosis, cardiovascular disease, diabetes, Alzheimer's. And then DNA mind, mental health, individual variations associated with mood, addictive behavior, cognitive decline. So those are the two tests I use the most that I'm going to explain to you tonight. But I really want to give you a snapshot of what a good test looks like. So the DNA health one that I do, now remember, functional medicine I talked about. I want to look at the functioning of your body and what the roots causing the disease potentially. So there are different areas that DNA health look at: cholesterol, lipid metabolism. This is where the Alzheimer's risk gene appears. Bone health, osteoporosis, methylation, inflammation. If you are a higher risk for inflammation, according to your genes, then you really want to focus on an anti-inflammatory lifestyle. And then I go ahead and share what that means. Detoxification: if we're not detoxifying properly, then toxins build up in our body. And you know what that means. Gut health, insulin sensitivity, risk for diabetes. A lot of people love the food responsiveness ones: the lactose, the gluten, the caffeine, salt sensitivity, and then vitamin metabolism. So these are the 30s. There's 36 gene variants that are studied. Now, this is a little graph that I made especially for you to help break all of this down into an understandable way. And it's very similar to the coaching process, where you've got all this information at the top. And then we want to drill down to be able to get to the so what factor. You'll hear me say that a lot, the so what factor. So, and this is where I get my top 10 action steps for you. So the top 3 functional health priority areas from all of this information, we want to get the top 3 functional areas. Then we want a summary of what to do in those top 3 areas. And then we'll look at every gene variant and have the report explain that well. And then my Zoom session will give you the action steps, that's the so what factor to move forward. Now, you only need to do this test once in your life, because your genes are your genes, your variants are your variants. But I can assure you that having this test, and I did this first in 2017, so 5 years ago, and I still refer back to it because it's 30 pages long when I want to dig in on another level of my health and lifestyle. So let's look at the top 3 functional priority areas. This is what it looks like. Now, this is actually my report, where it says the 3 things I had to look at were methylation, detoxification, and bone health. And this is the big picture. And of course, the report will go down, dig down into exactly what that means. But now I can see that this is my high priority areas, high priority. Then there's moderate and low priority. So these were my high priority areas. And to this day, this has changed, not just changed the way I take care of myself, but it's kept me compliant, because I know I don't have the enzymes, the correct enzymes working effectively for detoxification. So I know I need to support my liver with extra support. I know cruciferous vegetables, broccoli sprouts, infrared saunas. I know I need that extra support with detoxification, and I'm compliant with that because it's right in front of me. That's a high priority area. And it's good to know this before any disease sets in, for obvious reasons. This is true preventive care. Methylation: I'm not methylating properly, so I'm one of the person that needs to have a methylated B supplement, think of those agouti mice, because I have enzymes that aren't working as effectively in the methylation category. And then bone health, the great news with bone health, even though that might be a high priority area for me, because I do a lot of weight bearing exercise, strength training, I limit my caffeine, I make sure my vitamin D and calcium are good levels, then I have my bone density scan, then I'm good to go with my bone health. But it's interesting that genetically, I'm at higher risk for low bone mineral density. So I hope you're understanding this I'm going to stop sharing here for a second and chat to you. So know that even though they were high priority areas for me, it doesn't mean necessarily that things are going to happen. It just means that I'm genetically more predisposed to not be able to methylate properly, to not be able to detoxify properly, and to have poor bone mineral density. So it puts me laser focused on what wellness goals, wellness actions I need. So I saw some questions here. Were these mice the offspring of the mothers? Oh, yes. Yes, Terry. Those mice were the offspring of both mothers had the agouti gene. And the offspring, the big offspring that was big and yellow and obese didn't have supplementation, but the offspring that was brown did have supplementation. So thank you for asking that question. Okay, so I'm going to go back and take you to the next area. So with those 3 priority areas, this report will say if inflammation was a high priority for you and oxidative stress was a high priority for you, this is what's great about this report. It tells you, again, on a big high level, what you should do and what you should avoid. And it's very focused on food. And so we, in our discussion with the report, we will go through all of this and talk about ginger and turmeric and supplementation to support inflammation because you're high risk for inflammation, oxidative stress, what to do, what to avoid. So this, again, is what you want in a report, something that's very doable, what I call the so what factor. Then the report, digging even deeper, goes into every gene variant and what it means. And it has a very simple coding system. So if next to the gene variant, it looks a white dot, it means there's no impact, that everything's working fine enzymatically, no genetic predisposition, no genetic issues. The impact is none. Low impact, moderate, high impact. Those 3 areas for myself, detoxification, methylation, bone health, were all high impact for me. So these associated risks, diet, lifestyle recommendations are very important. And then there are some genes that have a beneficial impact. That's the great news. I do love telling people about beneficial genes. So here's an example. You want to look at, and again, this is mine. This is 5 years ago, since before they had the little round dots. All you want to look at is this gene impact. So what does this tell me? So I look at some of the issues here, like caffeine sensitivity. Now this, no impact. I know that I can drink coffee right before I go to bed. Not a problem. Now, I don't. But sometimes, say we go out to dinner, I feel like, oh, some tea or even a cup of coffee, really good coffee. I know that it won't affect my sleep at all. And this is why. Because I am a fast processor of coffee. This particular gene or genetic variation associated with caffeine sensitivity works. I'm fast processor. But if you have 3 dots here, you aren't. You could probably have to stop caffeine 10 o'clock in the morning or by noon. So we can look at caffeine sensitivity, salt sensitivity, which is can be impactful for hypertension. Bitter taste. I'm not a big fan of bitter taste like kale. I have to kind of doctor it up to make it taste okay. This is probably why. So this is how it's coded. And this is what we review in the test results. So it's so easy to understand. You don't have to know all these genetic variants, see all the names that they call them. It's very complicated. And this is what my friend's report showed. Just all these numbers had no coding to tie it to the so what factor. And then vitamin metabolism. Here's vitamin D. This shows poor metabolism of vitamin D. So we want to make sure that vitamin D levels are what we want, which is, by the way, 60, not 30, which is what a Western lab says is normal. But this particular person has some genetic imbalances in the way they metabolize vitamin D. So it calls on us to make sure that our vitamin D levels are maintained at that 60 level. And if you live up in the northern states where it's not sunny all the time, you want to do it twice a year because it is also impacted by sunshine. So we can look at vitamin metabolism. Now, detoxification, again, these gene names get very complicated. But when we do the report, we can go straight to the 3 dots. It says deletion. This case, G stands for glutathione, which is a very important antioxidant for detoxification. And this means a deletion in the enzyme responsible for this pathway. So we might need extra glutathione support. So immediately, this report can guide us straight away to action. That's what I love about this report. And I'm not going to look at all of these names. These get so complicated. But within 30 minutes of our Zoom session, you have an action plan. Now, it's nice too, under every category that I talked about, there is a summary. Now, again, my priority area was detoxification. So the report does not just leave it at that, it tells you what is recommended. So based on your genes tested in detoxification panel, and this is my report, your genotype combination contributes towards a decreased detoxification ability, increased risk for DNA damage, making this a high priority. And then it talks about what to do. Decrease exposure to environmental pro-carcinogens like cigarette smoke, charcoal, foods, pesticides. And phase 2 detoxification, there's 2 phases, which is increasing broccoli, cruciferous vegetables, particularly broccoli sprouts, and maybe some extra supplementation. So it tells you what to do. It's very amazing. And this is me. So I know many of you out there have been to Sonoviv, a functional medicine hospital in Mexico, which I used to take retreats to. And I'm sad to say that I don't do those retreats anymore, but I still go down there every year myself. And I always had the seaweed wrap. Seaweed is a powerful detoxifier. And they wrap you in seaweed. You go in the infrared sauna. No, first of all, you dip in a lovely salt bath, which is detoxifying. Then they wrap you with these hot towels with seaweed all over you. Then you go in the infrared sauna and you dunk in cold water, 15 minutes in the sauna, cold dunk, 15 minutes in the sauna. It's a 90-minute process. Fabulous for detoxification. And as I said, I am focused on improving my detoxification status because my genes aren't helping me any. So then gut health. So important to know your level of gluten intolerance. Now, you might know it yourself because just your own experience, but it is nice to know if you have where your status is with this particular gene and how gluten insensitive you are, sensitive or insensitive. And we can tell that through your Nutrigenomics report. Then there's a methylation status. You've probably heard of MTHFR. This is a very good one to know. And we can take action here. You might need extra support with methylation. And then with all of the information, I give you your top 10 action steps. And I think I gave you, here's an example. I just took an email, took all the names off. This is when I do a Zoom session, I will give you the key insights, like the things that you want to be most focused at, and then our top 10 action plan. I'm all about top 10 action plans. And then in our coaching work, if you choose to continue working with me, we can really see how you're doing, because this is a lot. This is a lot of action, but I like to capture it all as a result of the test, and then we can set our lifestyle plan in baby steps. So you can't do it all at once, but this is the outcome of testing. So it basically provides guidance to improve or mitigate weaknesses based on diet, lifestyle, and supplements. Okay, so that's the health part. And I'm so excited. I'm very passionate about mental health, especially in the last few years. So I've added the DNA mind test. And one of the reasons is just to get rid of this stigma of mental health. It's not a moral failing. And when you see the mental health report and you see your genetic predisposition, say depression, anxiety, PTSD, addiction, you could just see this is your genetic preloading. This. Now, it doesn't mean you're going to get any of these things, but it just might help focus on those actions that you want to do to support good mental health. And we look at Alzheimer's, we look at addictive behaviors, alcohol, nicotine, cannabis, interesting, opioid. There's even a gene that tests for the possibility of psychosis from cannabis use, which really is a thing. And eating disorders, depression, bipolar, so 30 different genes in the DNA mind test. Now, I'm just going to give you an example of two of the really motivating mental health genes, the ApoE4, the Alzheimer's risk gene, and BDNF, which is called the brain fertilizer, brain-derived nerve growth factor. So the ApoE4 risk allele, if you have it, significantly increases your risk for Alzheimer's. Please hear that. Your risk does not mean you're going to get it, because there are lifestyle factors. I make these charts for my clients. So if you have the risk allele and an increased risk, then these are the things to really focus on to keep that silenced. And exercise is the big one. And everything we do healthy for our bodies, healthy for our brains. So curcumin, fish oil, stress, big effect of stress on brain health. Stable blood sugar, Alzheimer's often called type 3 diabetes. So healthy diet and lifestyle. So these are all the things we talk about if that ApoE4 risk allele shows up in your report. And this is what we might advise for this. SNP stands for single nucleotide polymorphism. These are the variants that we talk about. So you want to drastically reduce or eliminate saturated animal fats. That's big on the list if you have that Alzheimer's risk allele. Low glycemic eating plan and lifestyle. Blood sugar testing, maybe get a glucose meter. So all of these things are action items. And that's why coaches, having this as part of our coaching work is so helpful. And then the other one I mentioned is the BDNF. It's a brain fertilizer. It's basically like brain plasticity. It helps the brain develop new connections, repair brain cells, which is really possible. And the BDNF gene, if it's working effectively, helps that brain plasticity. But if it's not working effectively, then this is the risk: depression, cognitive decline, impaired learning. So I made a chart. If you have this gene variant, the BDNF, again, there's exercise. If exercise could be put in a pill, it would make millions of dollars, the benefit it has on so many things. And here are the lifestyle actions if the BDNF risk allele is present. So I hope you're getting, without needing to know all the details, you're getting the understanding of the power of this testing. Okay, so that is the end of the information, but here I have for you. Don't go away, because now I get to share with you, yes, this amazing special, which I'm just so excited about because it doesn't happen very often. So today is Wednesday. So if you're listening live or listening to the recording, you have until Friday for this special. So you saw the DNA health test, and the DNA health test, which is a little blood spot, by the way, you're probably wondering how the test's done. It gets shipped to you. You do a little blood spot, kind of like a diabetes test, and it shows you how to do it in the little kit. And then you mail it back. It's all paid for, mailed back. And then the report comes to me as a practitioner in my portal. I let you know that the result is ready. And we do a Zoom session like this, but a meeting where I get to see you and I can share your report with you. And all of that is included in this price. So it's $140 off until Friday. And so this is, again, all of the areas. Remember the functional health areas, the biological areas that we test for. all included in DNA Health. So it's $349 until Friday. It's $140 savings, and it'll go up on Saturday. So, and in your chat, in the chat box, you'll see I placed the link. If it's easier for you to see, you can click on the link. It's a web page on my website. That's PayPal. But you can, I also put a link. If you're a Venmo kind of person, you can also pay by Venmo. So your choice. And this is the link again. This is in the chat box. This is where you would go to order the test. I would get notification that you paid. Then I'll be in touch with you to make sure the address that to ship is what you want, the phone number, anything that, all the information that I need, I'll be in touch with you to get. If you like Venmo, that's my Venmo at Dr. Karen Wolf 20. That's my Venmo name. And so that's DNA Health, but don't go away, because remember I talked about DNA Mind. So DNA Health plus the DNA Mind, it's only $50 more to do DNA Mind. So, and of course you get the Zoom session with me, which takes a little longer because we have 2 tests to do, to report on. So that one is $399. So $349 was DNA Health, $399 is the 2 tests, goes up by $200 on Saturday. So it'll go up to $599. So $399 for the 2 tests. And that one, if you remember, tests for Alzheimer's, for mild cognitive impairment, mood disorders, addictive behaviors. So it's really worthwhile to get both tests. So DNA Health, $349, or DNA Health Plus Mind, $399. So I'm going to look, if you have any questions, this is a webinar, so I can't see you or hear you, but I do want to get into the chat box and I want to see the questions. I don't see the link in the chat. Oh, okay. Let me see. I'll post it again. All right. I'm going to post the link. Post the link in the chat again. Copy. I'm going to stop sharing. And I'm going to post the link here. Paste. Post it here. There we go. So you should be able to see it now. It says webinar special. Is this a simple blood test? It's a finger prick test, Melissa. It's just a finger stick, kind of like a diabetes test. If you don't like that and you want a buccal swab, you want to do it for saliva, then I can send you that test. But you get a better sample with the blood spot than you do with the buccal saliva swab. That's why they changed it. Ankita said, this is a great deal. Yes, it is. I don't see the link. Betsy, make sure, do you see the link now? Ankita, can you see the link? Hopefully you can see, I got the link. Okay, great, Betsy. Okay, I'm just looking at the chat. You're enjoying the webinar. That's great. If I take this test, is it helpful information for my children as well? You know, that's such a great question, because remember, our genes are our genes are our genes, and they are what they are. So with children, it would depend what age, and you might want to reach out to me and talk to me some more about that. I will put my email here, email at drkarenwolf.org. That's my email. If you have questions about that or any other questions, you can certainly ask me. It is helpful for children. Methylated, Sharon's talking about methylated B. Yes, there's a specific methylated B that I recommend. So you will find that out when you do the testing, or you can email me. Let's see, any other questions that I missed? Let's see. No. Okay, keep putting. How does sugar affect our genes? Oh, how does sugar affect our genes? Well, that's a great question. So remember, we are talking about epigenetics. Epi, how everything in our environment affects the expression of our genes. And let's just take an example of Alzheimer's disease, which is considered type 3 diabetes. So high blood sugar puts you at risk of Alzheimer's. But by reducing your blood sugar or stabilizing your blood sugar, it reduces your risk of Alzheimer's, even if you have the gene. So rather than talk about how sugar affects our genes, you want to look at the genes you have and what your risks are. If you show high priority for diabetes and insulin sensitivity, then you definitely want to take part. Even if you don't have diabetes now, you want to learn ways to maintain a stable blood sugar, a low glycemic lifestyle. So that would be super important. So again, someone asked to put that up. I'm just going to share my screen one more time. So that is the special. Just so you know, on my website, it's a PayPal link. Very simple, very straightforward, very safe. I use PayPal all the time. But if you would rather pay by Venmo, you can pay by Venmo. If you have any questions, you can email me. And everybody will be getting a copy of this recording. If you attended, if you registered and attended. So let's see. Oh, Angie, you're there. I didn't see you, Angie. Hi there. Hi, Angie. Yay. So Angie asked what the normal rate is. So yes, if you do DNA Mind and DNA Health, it's normally $599. So you're saving $200. So I had that in one of these slides back here. One of these slides back here. I had, oh, now it won't go back. This one, DNA Health plus DNA Mind is normally $599. So it's $600. Angie, you're right. So it's $200 savings on these two. So thank you for asking that. Another question in the chat box. I have a student here with me and I dragged her to your seminar. Oh, hi, Britt. Hi, Britt. Yay. Dragged her to seminar because I watched your session with Deb. Right. Can my friend use the same link? Yes, of course. This link. Yes, Britt. Yes, she used the same link. Yes. Thank you for asking. Okay. Any other last minute questions before I head out? Oh, hey, Britt. Oh, my gosh. We go way back. Melissa. Hi, Melissa. Is it possible to record our individual Zoom with you? Absolutely. Yes. In fact, it's a good idea. I can record it, of course. I send you a Zoom link. And if you just remind me you want it recorded, because everything we cover, of course, is your confidential information. And you might want to go over it because I do cover a lot. Yes. So, Melissa, absolutely. Thank you for asking that, because a lot of people don't ask me that. And sometimes I forget to offer it. So, yes. Can we just do DNA Mind and at what cost? Oh, hi, Rose. That's right, because you already did DNA Health. So I can email me and I'll let you know what that is. It's probably the same. If you just do one test, it's $349 and then $50 for the extra, just because they use the same sample rows. But you've already done, your sample's already in, you ordered it already. So I can ask the company what it would cost to add that for you, okay? Because they already have your sample, correct, Rose? We already did that. So they already have your sample and it's been less than 6 months. So I will find out for you. Okay, any other questions? Great questions. There was something, yes, I wanted just to encourage you to email me with any extra questions about this. And my goal tonight was to kind of make this as understandable for you as possible and for you to really have good information before you dive into doing this testing, because there are a lot of testing companies out there and they're not all great, but I love this one. Your knowledge is breathtaking. Oh, Melissa, that is so sweet. I love doing this. Thank you. I've been telling all my students and family about this. Wonderful. Well, I hope you enjoyed this. I hope it just gave you a window into how to create even more health, both physical and mental health in your life. That's my goal, because remember, I'm part of the Creating Health movement. And the more informed and educated we can be as healthcare consumers, the more in charge we can be of not just our health, but our family's health. Yes, Melissa. Okay, so it's great to see you all. I'm going to sign off. I hope to see you all on Zoom when I go through the report with you. So many blessings to you. I'm so glad, Betsy. Oh, hi, Betsy. I see all your names there. Betsy. Oh, my gosh. All these great friends from way back. Thank you. Much love. All right, everyone. Bye for now. Bye-bye. Bye-bye.